Let's talk about some of the things we do as surgeons to minimize the chance that you get an infection or a biofilm on your implant. So first thing is Keller funnels. Keller funnel is a disposable funnel that's lubricated. You place the implant inside and it allows us to place an implant through a small incision and it will never touch the skin. By avoiding touching the skin, you minimize the chance that bacteria are going to get on your implant. Everyone should be using a Keller funnel, so make sure you ask. Next thing you mentioned is shields. So putting a dressing over the center of your breast, over the NAC, has been shown to decrease your chance of getting an infection or contracture. So super simple, all you do is put a piece of tape there at the beginning of the surgery. The last thing you mentioned, I think not arrogance, but irrigants. And these are the fluids that we use to clean things while we're doing surgery around the implants. And there's a variety of different things that you can use. We of course use just plain old boring saline. You can use betadine mixed with saline at certain concentrations. It works really well to get rid of bacteria. There are people that like to put antibiotics in their irrigants of different combinations. And my personal favorite is hypochlorous acid solution called Phase 1. Another name that you'll see, a different brand name, is Vash. And then finally, some of the other things you didn't mention that we do is I like to change my gloves anytime I'm going to start working with the actual implant. I re-prep the skin with surgical soap right before the implant is placed. And some people also will put a Tegaderm dressing over the incision, make a little slit, and then put the implant through that. So those are all of the things that we do in the operating room that have been shown to minimize the chance of infection or contracture if you're having implant surgery.